Would someone showing no symptoms still benefit from a repair or a replacement?
If someone has what we would call critical aortic stenosis, where the valve area is less than 0.5 centimeters, they may benefit because they're at a higher risk for having complications happen. Well, first, important to remember, why do patients have to have surgery at this? Some patients will come and say, well, why do I need to have surgery? I'll live with my symptoms. It's because we know from natural history studies that 50% of patients who present with symptoms of chest pain will be dead 3 years later. 50% of patients who present with heart failure due to aortic stenosis will die within 2 years. So these are all important things to know, that it is a disease that will kill people with time if it's not treated.
So what's then the difference between repairing and replacing the valve?
Well, the aortic valve can't really be repaired that well in most of these situations, except maybe if it's leaking. If the valve was enlarged, if the aorta was enlarged and the doorway caused the valve to leak, then that can be repaired when the patient is when the aorta is being tightened up and made smaller again. But for aortic stenosis, you can't really repair it; it needs to be replaced.
What other minimally invasive procedures can you do?
So the minimally invasive procedure is what's called transcutaneous aortic valve replacement, or the acronym is TAVR.
Which we'll talk about, yep.
And that's done through a catheter-based procedure where a valve is folded up on a catheter, and a trained surgeon or interventional cardiologist working together will place the valve in the position of where the aortic valve is. Presently, we'll crack open the tight aortic valve and put the new valve in